Welcome to the Birth Lounge Podcast, an empowering space for expecting and new parents to hear candid conversations with experts, support your mental health, and learn the tips and tricks that thousands of parents have used to craft their ideal birth. We will answer all of your questions, the scary ones and the weird ones, to help calm your fears and feel confident going into your birth. I'm going to help you redefine what birth and motherhood looks like and how to embrace your journey. I've intentionally crafted a list of experts to help you navigate pregnancy, explore your birth options, and plan for postpartum so that it can be a time of soaking in your tiny human. We're going to go there on all the hard topics so that you can dive deep into finding your confidence and freeing yourself from fears around birth. With over 10 years of experience in family education and a master's degree in human development and family studies, I created this podcast as a way to share the resources parents need to make educated and informed decisions about their care in pregnancy and childbirth. This is a birth community driven by evidence-based information and research in hopes to help you explore your options, understand your rights, and know what choices you have along the way when it comes to birth and beyond. I'm your host, HeHe. Now let's get to the good stuff. Welcome to the show.
Thanks, HeHe, for having me.
Absolutely. I'm so excited for this conversation. I think obviously working out's always on everyone's mind when you get pregnant, and we all know that movement's really good for us, yada, yada. It's hard to get to the gym, and I think that a lot of people can put it off, me included, myself included, as I'm going to start this tomorrow, or I will get to the gym. I'm going to get to the gym, or yeah, I'm going to sign up for that membership. But today we're going to talk about actually how important it is to have this functional movement. And it really isn't something that you should be putting off, because if you don't have the muscle strength for this functional movement, there can be some pretty serious consequences, even injuries that can occur that we probably didn't know were coming down the line to us because we just don't think like that. I don't think that this is talked about a lot, especially in motherhood, but just like in our American society at all in general. So before we dive too far into like injuries and what we need to be aware of and how do we actually move our body in this functional way, can you break down why it's uber important in pregnancy to have strength building and to be focused on actually preparing your body for postpartum and how you're going to be moving in terms of like hormones and your musculoskeletal system and body functioning, the loosening of our ligaments, all of that?
Totally. I'm so excited to talk about this topic today. I have been a physical therapist for a long time and have always treated patients during pregnancy and postpartum, but it's very different going through it yourself. So I have a 7-month-old, and going through that postpartum phase, I was grateful that I had the knowledge and had the experience to actually be training during pregnancy, because I had no idea how much that was going to be benefiting my postpartum phase. And just to think about things that are going on in pregnancy, of course, we all know that our bodies go through a significant amount of change. What we may not understand at that point in time is, of course, we see our belly getting bigger, hips getting wider, but we don't really see or understand what is happening in that period of time that could affect the rest of your pregnancy and postpartum in terms of musculoskeletal strength and injury. And just to want to give a little background, of course, we know our hormones are all over the place during pregnancy. And as a result of that, we have a lot more laxity in our ligaments and our tendons. And those are going to be the pieces of our body that hold and support our skeletal system. So all of our joints and our bones with the help of the muscles. And so what tends to happen is, as we start to go through pregnancy, the hormones shift and our ligaments and tendons become super lax. We don't have as much stability in our skeletal system to help us move in a safe and effective manner. And so that is really where I see a lot of injuries, and where I'm treating a lot of women during pregnancy is usually in that second trimester, when things are really starting to shift into high gear. Usually that's the trimester that you're feeling super energetic. You're finally getting your life back. So you're getting back to doing things that you like to do. And if you haven't been training, those changes in the hormones and the skeletal system can then unfortunately set you up for injury. I know most commonly patients are tending to report back pain, especially low back pain, or even sciatica, so pain down the leg. And it can be quite debilitating on top of the changes that are happening in pregnancy and the aches and pains that kind of go along with that. And so, what's really important is to be able to manage that mobility coupled with stability. And that's really where strength training comes in. And so, that's really where my passion has gone with treating this orthopedic population to just help hone in that balance of mobility and stability.
It makes a lot of sense because that hormone relaxin is rushing through our bodies. It is increasing as our pregnancy develops and goes on. And so, if the problem is weak muscles, then obviously the answer is strength training that. That makes so much sense to me. Same thing with things like hip pain and pubic symphysis. Yes.
Totally, totally. You might hear bursitis or it's painful to sleep on your side, and that tends to be like the only approved position to sleep in. And so this really can pose a problem. What we're really feeling is just too much mobility between those bones that this and the muscles are not there to support it. So what really we're not saying, and I know exercise during pregnancy can be a little bit controversial. And so I'm certainly not insinuating in week 30 to just start a CrossFit program just because you need to start working on this stability. But gradually through the pregnancy and then carefully tapering off as you get closer and closer to your due date, of course, you have to keep that in mind. Working on functional exercises that might be mimicked or will be mimicked in postpartum. So, for example, I know I'm jumping around, but if we think about the postpartum phase, nobody really tells you that really like day one, you're already going to have to be bending down to the floor, squatting to the floor, bending into a bassinet, which can already be uncomfortable just with a natural delivery, but particularly even with a C-section, you've got some pain and you have a scar and you have to manage all of these things. And I think what's also not really thought about is how your center of gravity changes throughout this period of time. And so you go from naturally shifting our center of gravity with a pregnant belly. But once that baby is delivered, you don't necessarily have that core strength and stability you had prior. And now this center of gravity is being shifted with all of these movements I just mentioned. And that's really where if you don't have the strength to manage that or adapt to it is where some injuries can happen. So the frequent bending forward, the carrying the car seat on one side, the holding the baby on one side to feed, whether that's bottle feeding or breastfeeding. And that's really where a lot of injuries come in. And so really focused training pre-delivery, so during pregnancy, can help offset those injuries that we maybe expect or do see.
It makes me think of sway back too. That must be an overcompensation of muscles because of that center of gravity being so off. Your back is actually swaying, and that must lead to injuries. What kind of injuries do you see if our bodies aren't prepared and strong enough for this functional movement? And we are seeing all this overcompensation.
Yeah, totally. And that sway back posture, I'm really glad you brought that up. Part of that too is kind of that ligamentous laxity on the front of our body. And so sometimes we should have a little bit of a lordotic curve or a nice concave curve in our low back. But when we don't have the actual tightness and those ligaments on the front of our body, in front of our hips to hone that in, that's when we start getting that excessive low back posture. And so a lot of truly the most common injury is low back pain. A lot of that reason your center of gravity has now shifted. Your vertebra, your bones, and your spine are getting closer and closer together and creating pain. And that's where sometimes that sciatic pain can come down the leg as well if the nerve is involved, maybe numbness or tingling. So a lot of that low back and hip related pain, I certainly see a lot. What I had treated a lot and didn't really have a full appreciation for until I went through it myself was a lot of shoulder pain and shoulder injuries and even mid back pain because everything we do for our baby is forward and it's all typically one-sided. You're most comfortable going towards your dominant arm or the hand that you do everything with. And so that kind of overuse coupled with very asymmetrical motion, which is just going into that internal rotation over and over again without correcting it or having any exercises to counterbalance that motion, that's when we start to see these overuse injuries. So maybe some rotator cuff impingement, sometimes even that could translate into some carpal tunnel like symptoms. And a lot of that is postural related and overuse related. So those I would say are, and of course, the neck pain. Again, just everything forward. If we're all coming forward and not doing anything to work the opposite direction, over time, the body just can't keep up. We're asking more of
Sure.
it than the muscles are capable of doing at that point.
Yeah, the body wasn't really designed to work like that. We're asking it to work outside of its kind of designated coding, if you will. Okay, so we're doing a lot of talking about people who have the flexibility and have this mobility, but what about people who lack that mobility or who don't have a lot of flexibility? What do they need to be thinking about?
So I think it all comes down to balance of enough mobility with enough stability. I will say sometimes it's better to be a little hypomobile than hypermobile. So a little less mobility or flexibility than hyper, or more mobility and flexibility. And that's for the sole purpose of, if you think about, I like to use this analogy when I teach a lot. If you think of that candy like saltwater taffy and you go to pull it apart, it's very stretchy. It's going to stretch forever and ever. It's really hard to get it back to that super small piece that it once was. So if you think of that as your muscles, if you're going to stretch something that's already overstretched and then you continue to stretch it and stretch it, it can't contract very well, meaning you can't get very much power. You can't get very much contraction or performance from that muscle. And that's really where we see a lot of injuries occur. You're asking it to be powerful. So you're squatting quickly, you're bending quickly, you're going up the stairs quickly, you're getting out of the chair quickly. We're asking it to be powerful. But if it's got too much mobility that it can't effectively contract, it sets you up for injury.
Hmm. That makes so much sense if you just stop and think about it. And I think that's the problem. Not a lot of us really stop to think about how we can properly support our body. And I think we live in a society that when there's pain, we don't necessarily all of us. I'm still trying to train myself. I think a lot of us are on that journey of training ourselves. Don't go straight to pharmaceuticals. Don't go straight to the doctor. Sometimes it's a structural thing. Sometimes you just need strength training. Sometimes you just need to remove something from your diet. You need to add a supplement that you're missing. There might be something that's alternative than painkillers, and there might be something that's underlying. And this is just a perfect example of you don't have to live with that pain, but let's get to the root cause of it. It may not be a belly band. There's probably a reason the belly band's not working. You need the strength, right? Okay, so I mentioned belly bands. What are your opinions on things like belly bands and K tapes? For me, they seem like good supports but temporary, so you shouldn't be using them as like a resolution because they're not. There's something to give you temporary relief, but again, we've got to dig deeper and get to that underlying problem. Where do you stand on that?
I completely agree. I think there is a time and place for everything. And a lot of it, remember, because all these changes are happening, they're not, our body has been so used to being not pregnant and working in that sense. So this really does turn everything upside down. And you have to quickly, your body has to quickly adapt and figure out now how to change all these movements they've been doing all this time to this particular period. I think for sure belly bands, SI belts, kinesio tape, what those are all external stabilizers, right? So they're not, muscles would be internal stabilizers. These are all external stabilizers. And I think for not only some probably immediate relief, it's giving good tactile feedback. And so we call tactile feedback any information that's coming into the body to get the brain to muscle connection working a little bit better. And so while it's an external support, you should be using that as an adjunct to focus strength training. So now you're giving your body the support that it needs. It's just like wearing a knee brace. You're giving the body the support that it needs, but you should be coupling that with corrective exercises so that you get to a point where you can remove the external support because you've built up the internal support, which is what our bodies were meant to do. So I do think that there is a time and place for them. I don't think they should be used long term because then it becomes a little bit more a crutch, right? Like you're like literally an external support that you're relying on versus focusing on what the musculoskeletal system was meant to do for us.
Okay, so what does this corrective exercise look like? Is it looking like CrossFit and HIIT exercises and really intense? Is it functional movement, something like bar or Pilates? Expect when they go into a practitioner that practices corrective exercise.
Yeah, I think the reason why physical therapy is so great, and of course I'm biased as a physical therapist, but the reason why I think we're so great is because we really focus, exercise is our primary intervention, and our job really is to assess the entire body. Remember, the body is working together as one whole piece. So we have to figure out, sometimes it's hard to say what came first, the chicken or the egg, but it's our job to tease through the symptoms you're presenting with and determine really where we're going to start and fix one piece at a time. I think overall, in general, especially during pregnancy, when our hormones are all over the place anyway, one hormone that we really want to keep in check is cortisol, right? And that is our stress response, stress hormone. And so when you've mentioned HIIT training or CrossFit or things like that, again, I think if you've been doing that all along and it's not something new you're starting in pregnancy, you probably have trained in a way that you are safely moving. If you have never done that before, it's probably not a good idea to just jump right into it during pregnancy.
Don't introduce it during pregnancy.
Yeah, right. And so I think that what actually we should focus on for somebody who maybe hasn't even done any regimented exercise and really just wants to get started is this more functional movement from a strength training perspective. And so that is going to be more usually like pushing, pulling, squatting exercises, something like a deadlift or farmer's carry. We really want to hone in on this principle of specificity of training. And this typically comes into play for like athletes, especially in their rehab process where they're trying to train to mimic the activity they're trying to do. For soccer, for example, it's a lot of powerful unilateral kicking. They probably should be working a lot on that in their training to carry over into the actual game. And so same thing with pregnancy and postpartum. In pregnancy, you want to be working exercises that are not only stabilizing you in the moment, but are going to pay off in the game, which is postpartum. So thinking about farmer's carry mimics holding a car seat. A deadlift mimics bending over into the bassinet or the crib and lifting the baby up. So really focused exercise from a strength training perspective. I'm coming back to cortisol for a second and your high intensity comments about like high intensity exercise in terms of cardio. And really, there's a lot of research going on right now about zone 2 cardio. And this is really, strength training can fall into that too. And this really is that point in which your heart rate is somewhere between 60 and 70% of your maximum heart rate. So there's a little bit more specific equation, but the basic equation to find your maximum heart rate is saying 220 minus your age in years. And that's your maximum heart rate. So then you take that number and you calculate 60 to 70% of that, and that's your zone 2 range. And what the research is showing is that's really the range where you can benefit the heart from a aerobic and cardiac perspective while maintaining muscle and stabilizing cortisol levels and also really improving mitochondrial function. And the mitochondria are the powerhouses of the cells. Every cell in our body has mitochondria, and really the better your mitochondria are working, the better the cells are working, the better the organs are working. And we want all that in tip-top shape always, but especially during pregnancy. I think it's important to note that pregnancy is stressful in and of itself. And so is exercise, let's be honest. But the body sometimes has a hard time discerning good stress versus bad stress. And so keeping that cortisol level in check in ways that we can, particularly through exercise, is going to give you benefits without the negative effects of elevated stress.
Which is super important in both pregnancy and postpartum. Cortisol in general, it's getting a lot of light right now, but it's a good hormone to have. Like we need cortisol, but it can easily wreck your system if we allow it to get out of control and we're doing things that contribute to that overproduction of cortisol for sure. Okay, I have questions about postpartum functional movements. We have our baby, and now we're thinking now what? I think a lot of people think, now what? Okay, what am I supposed to do now? Where do I start? I think it can be really intimidating too to get back into the gym, maybe not knowing if there are things that are now different with your postpartum body that you should be aware of and injuries that you're more susceptible to now that you've had a baby and you are working with a postpartum body that's having postpartum hormones, and whether you had a vaginal or C-section delivery, whether you're breastfeeding and have those hormones going, or you are not feeding your baby that way. There's a lot that goes into postpartum. Talk to us about the importance of having a really structured and intentional postpartum corrective exercise plan. I don't really want to call it workout or even fitness because it's more like strength building your body for everyday movements that you have to do to be a parent.
You nailed it. HeHe, you nailed it. That's exactly the point. And this is really why getting yourself set up, ideally during pregnancy, but especially postpartum, with a skilled physical therapist who can actually, determine and understand all of the changes your body has gone through and then help you create this corrective exercise routine. And that's really exactly what it is. It's corrective exercises to offset just what it takes to be a parent, all those unilateral asymmetrical movements that lead to overuse. Think about it. How many times are you feeding a newborn? How many times are you reaching in and out of the crib? How many times are you doing all of these things? And for just an example, if everything we're doing is forward, which it is with the baby, we're holding the baby forward, we're feeding the baby forward, we're looking down as we're feeding, everything is forward. We're getting a rounded back, rounded shoulders, rounded forward head. If we do that over and over again without correcting it, so setting yourself up on a program to work shoulders back, right? Like working those retractors and working the mid back strength, basically working everything on the back of the body. That's now becoming a little bit more, if you think about it, you're forward, then everything on the back of the body is turning to that taffy, getting overstretched, while everything in the front is getting a little bit more tight and condensed. Then we're ultimately setting ourselves up for some of those repetitive injuries and changes in our posture because the muscles on the back of the body are just simply not put in an effective way to contract. And so that's really where physical therapists can come in and educate, first of all, the new parent on all of these changes, because I can speak for myself in those first couple of weeks, with just regardless of the health knowledge or muscular knowledge I had, that'll went out the window. I was just trying to keep my baby alive. So I didn't really think of those things in the moment until I started having pain myself. And I was like, okay, we got to start working this. And gratefully, I knew how to implement a corrective exercise program. It's good to start thinking about it now because it's very easy to not think about it in those first few months where everything is a whirlwind. And so setting yourself up with a professional that can really analyze what's going on, help you come up with corrective exercises. And I think the most important thing, and you're talking about in the opening of the show about going to the gym and finding time to do it. Time is scarce in those first few weeks, months. It's true. And so my goal is to give exercises or to give a routine that is feasible yet effective. So I'm not expecting you to have 30 minutes a day even to be doing some of these exercises, but how can we build them in during your day? Maybe you're doing a few of these exercises even before you get out of bed in the morning, because we can figure out how to do them lying down, or you put the baby down for a nap, you're doing 10 reps of something, but it's building up over time that's going to help. So I know if I was given an exercise routine straight off the bat that was going to make me up in my gym for 45 minutes, that was never going to happen. So compliance and understanding the benefit comes from education and being realistic with your exercise prescription.
Yeah. Where can someone find a practitioner that does functional movement or corrective exercise? Is there a website that we can visit? Are there credentials we're looking for? Are there questions that you should ask?
Yeah, I think any physical therapist graduating from an accredited university should be able to give you this exercise prescription. Of course, experience is one thing that you could look for. There are specializations within the field. So I am board certified in orthopedics. So that is something that you can look for as well. And it just means we've done additional training and we've put in extra time into education to become a specialist in orthopedics. Not to say that somebody who doesn't have that certification isn't just as good, but if you're looking for things like that, some of it is just asking. Hopefully your physician has a good strong referral source to physical therapists. The you can There's directories through the APTA, the American Physical Therapy Association. You can find people local, but I do just want to point out too, I do not consider myself a women's health physical therapist or a pelvic health. I'm certainly not a pelvic health physical therapist. And I think that's where thank goodness we have PTs who do all of that because it's so important. But I think that we sometimes consider the physical therapy help from pregnancy and postpartum to be somebody who is a women's health or a pelvic health specialist. But really, they just need to have a really good understanding of the orthopedic realm and musculoskeletal system, as well as understanding the changes that have occurred during pregnancy and postpartum.
Yeah, and how to balance those out as they change, because you'll change throughout your whole pregnancy, and then again in postpartum, and then again later in postpartum, and then again
Totally,
later in
totally,
postpartum. Oh, to be a woman, how lovely.
totally.
Elena, this has been so informative, and I think it makes so much sense. And I think it's also very comforting to know that if you're dealing with sciatica or hip pain or lower back pain or pubic symphysis, or you're having that shoulder pain, that neck pain, you're having trouble in pregnancy, postpartum pain, it doesn't have to be. And a lot of
Right.
times it's due to muscle weakness, which is totally in our control. And there can be easy things that we can implement very functionally into your lifestyle to be able to fix that and to get you to a pain free, very strong, and enjoyable place in life. That's amazing. Is there anything that we haven't covered that you think people should know or should be prepared for, or just anything we haven't talked about?
I'm so glad that you're bringing this topic to your podcast because I think in general we can all agree that there's very limited research on pregnancy and the change women in pregnancy. There's just really not, almost a little bit like a protected class for good reason, right? You don't want to be really experimenting on things during pregnancy. But I think that's led to a lack of really important understanding. And I think Whoop has actually started to collect some data and really spearhead a little bit of these changes in pregnancy and how you can manage your strain versus rest and recovery. So I love to see that. And I'm hoping more and more research comes out of it. But I think that's where some of these, not necessarily misconceptions, but these hesitations about things like exercise during pregnancy have come about. And it makes you fearful to do something that you don't really know is safe or not. And I think if we take a step back and really think about kind of the common sense of it, like you're expected to care for this child the second it's born. Why shouldn't we train for that? Because what's going to happen if you do get injured, right? And maybe you have a great support system, maybe you don't. Then what happens? So I'm just really grateful that you're bringing this to light because clearly you could probably see it. It's a passion of mine and why I wanted to come on the show. But just to spread awareness and information that there are safe ways to go about this, and there's a reason we should.
I love that. Oh my gosh. Yeah. You're such a special human to me, and it was such a honor to be on your birth team and to help you in that journey. And I love what you're doing. I love your mission. I love that you're talking about this. I don't think a lot of people think about this, and I think it is something that's super simple, albeit maybe not mentally. I think it's probably a mental struggle, but if we can just fit the time in and commit to doing it, simple strength building can really make a whole world of difference. Okay, Elena, if people were interested in learning from you or connecting with you, or if they were in the New England area, in Massachusetts, Boston area specifically, and they wanted services from you, you also do telehealth. How can people connect with you and take advantage of your educational offerings and your services?
Yes, similar to your business model, I do have a little intimate concierge-based practice that I treat patients with. I don't have this huge, crazy social media presence. I also, to reiterate, have a 7-month-old, so I haven't really been able to streamline that. But I do have, you can access my page, EDM Physical Therapy, through Facebook, or I will give HeHe a link to an email list that you can contact me on that as well. Also, if you are a member or become a member of Fountain Life, then I can provide services there too. That is telehealth. Yeah, that is how you can find me.
That's awesome. Thank you so much for being here. I really appreciate it. And listeners, I know that this conversation was maybe the first time you've ever thought about this. Maybe you just thought, hey, this pain is normal, or hey, you just have pain as you get old and you age. And I do think part of that may be true, but I think a lot of it is super avoidable by strength training and making sure that you're understanding how you can actually use functional movement in your life to keep your body stable and strong and pain free. All right, you guys, connect with Lena, and I will see you next episode. You can also find me on social media at Tranquility by He or at the.birth.lounge. Until next time, head to your app store and download the Birth Lounge app for evidence based childbirth education and data driven postpartum support delivered straight to your phone. Bye. Thank you so much for tuning in today. I truly do value this community and I love hanging out with you. You deserve to have a birth that you love with a provider that values your autonomy and respects informed consent. It's an honor to be your go-to gal when it comes to preparing for your baby. If you found today's episode helpful, share it with a friend. Share it with someone who could use evidence-based information to help them have an informed and confident birth. I'd love to hear what you have to say and read your sweet words. By leaving us a review, you are helping other expectant mamas and their families find the podcast so that we can reduce birth trauma and improve maternity care in the U.S. one birth at a time. If you're interested in joining the Birth Lounge, go to thebirthlounge.com. If you want to connect with me on socials, you can find me at Tranquility by HeHe on all platforms. Until next time, stay educated, stay supported, stay confident. Bye.